it's the interaction. I really enjoy the interaction when we're able to do it in person, but hopefully you'll still get a lot out of this, and don't be shy to please make sure to ask questions. As Chuck said, if you have one during the presentation, just do that in the chat box. Otherwise, we'll have time for Q&A after the speakers are done. So with that, I think we can turn it over to Pat. Pat, thank you so much for joining us. We know that your days must be incredibly long and stressful right now. But if you could just briefly tell a little bit about yourself, what your role is, and then go ahead and share your presentation with our candidates, that'd be great.
Good morning, everyone. I appreciate being able to join you this morning. I'm Pat Lopez, as you heard, and I'm currently the health director here at Lincoln-Lancaster County Health Department. Most of my career, I'm a nurse, and I started out originally as a public health nurse here at Lincoln-Lancaster early on, and worked here for almost 30 years, and then had an opportunity to do some statewide work, and have been working for a period of time doing advocacy with local health departments, working with connections with our lobbying organization for the health departments after they were started statewide. I'm an accreditation site visitor for the Public Health Accreditation Board, the national board. So I work with our local health departments on accreditation practices, and then just doing some different work in areas around the state connecting primary care and public health. I came back here almost a year ago to assist when our health department here was going through a difficult time with the current health director being very ill and passing away due to cancer. And so I came back to help out for a short period of time, and then things changed again. And so now I've been here a year. So my background, the most of my career has been spent in public health and working with local public health, local officials and boards of health. So just to give you a little background related to that. So right now in the current environment we're in, this is a pandemic. We had what was called a pandemic back in 2008 with the H1N1 flu, but nothing like this since the Spanish flu pandemic has ever occurred. And even then, my 90-year-old aunt has told me the Great Depression wasn't anything like what we've been experiencing with this pandemic. Right now in Lincoln, just to give you an idea, we have almost 800 cases. We're about the 4th highest in the state. We talk about who's recovered and our testing result, but statewide, we have over 10,000 individuals that are impacted with COVID-19 and 128 new positive cases every day. There's some hot spots you've probably heard of. Lancaster County is one of them. Douglas County is another. Dawson County, and what you'll see in Central, which is Grand Island, and South Heartland and Hastings, these are generally areas where we have some meat processing plants that are experiencing this. The majority of the deaths from COVID-19, I think they've said over 60% or 70% are from individuals from long-term care areas or older adults, which if you look at what the disease is, where those people are most vulnerable, it is older adults over age 65 and those with underlying health conditions like diabetes or respiratory problems and that. So we're continuing to monitor, but what's happened when the pandemic starts, just to tell you, at the local level, whenever we have some kind of public health emergency, we utilize a unified command system. So, and every one of our local health departments has that process in place across the state. So we bring together police, fire, medical, and others to address what needs to be done with during the pandemic. So I'll just talk a little bit about what our system is like here, and know that this is a similar process across the state. But every morning, my morning starts out with a situational update, and then I meet with our two main health systems to talk about what's happening. We have drive-through testing in Lincoln. We're very fortunate here that both St. E's and Bryan are providing drive-through testing, and that's been very successful. Other parts of our state don't have those same resources, which is always a concern as we move out more rural. Then we also, in our unified command, meet and we work on what do we have for PPE. All of that is handled through the local health department and disseminated out into the community. So we have a requesting process that people submit their requests through electronically, and it goes out. There's a priority system for healthcare systems and other providers because we need those frontline people to get the PPE first. That's the biggest priority for those who are caring for COVID-19 patients. And that PPE can be anything from N95 masks to gowns, shoe coverings, gloves. There's a whole spectrum of what's provided. And we've had a huge shortage of gowns. So our staff have created a method to do using Tyvek to develop and make gowns for our first responders. So the local health departments work with the school systems, and in our case, our school system, one of the things they're doing is providing the cutters and sewers for the gowns. We also have another site where the drive-through site in North Lincoln is at the school system, so the school works with us. Every one of our health departments works closely with the schools on closing, openings, providing guidance on what would be the safest process for them to take for their staff. So addressing a whole variety of issues related to COVID-19. We're on a weekly call with the school administrators across the state, in addition to working with our own local school systems. And that's all, not just the public school systems, but like in Lincoln, we have our parochial and our private schools, we have our rural schools. So we're all working together in a unified way. And we also work with our colleges and the university and how they can reopen safely. The other area we are working with, there's a lot of innovation that goes on during a pandemic. So Duncan Aviation in Lincoln is providing the processes to develop face coverings for individuals in the community. We've done a lot with the nonprofit organizations to get PPE out to them. One of the other main areas we looked at is our food supply. So we did contact the National Guard to assist our food bank and one of our food distribution centers here to get out food. And they've been able to really work with them. There's a huge increase in demand on people needing food. One of the things that we're going to be concerned about now is that public schools are going to be stopping providing their food at the end of the month. So we're looking at what can we do to ensure that families who may have never been in this situation before have the adequate supplies they need. We're seeing a lot of individuals impacted financially that have always been able to manage, and now they're in a position where they have to ask for assistance. And so it's really difficult for them. So we're trying to provide those resources in the easiest way possible for them to access. We also work with our cultural centers and our racial and ethnic minority communities to get message out in multiple languages in ways that are helpful for them. We just did a drive-through screening site with Brian here in Lincoln on last Friday. That was open to individuals who may not have English as their first language, and other members of the racial and ethnic minority community. And we had a good turnout for that, and we'll continue to work through that. The other area that we're working on, there's so many, is long-term care. You probably heard a lot about that. We were fortunate that we were able to learn from what's happening around the nation and get ahead a little bit here in assisting the long-term care centers and putting information in place and processes in place for improvement. There, you've all heard about some of the outbreaks that have occurred in various areas of the state. And I think there's been a tremendous opportunity for improvement. So we've been fortunate in Nebraska. Well, we've had some outbreaks, some more concerning than others. Overall, we've been extremely responsive. That's a priority area. And long-term care centers are a priority for both testing and receiving the protective equipment that they need. As far as testing, Test Nebraska has been rolled out. They're still smoothing out some of the processes. The lab that runs that test, all those tests, is located actually here in Lincoln at St. Elizabeth Hospital. And they complete all the lab tests. Now those are being out to local health departments. So the other thing you hear a lot about in the news is contact tracing. And I just want to let you know that's not a new process for local health departments. We've been doing contact tracing. I've been in public health for a long time. I won't say how long, but that's always been part of what we do, and working towards identifying individuals and then looking for commonalities and looking for other places where we might have a cluster of events happening and trying to identify a single area of infection that we can work on with this. We have a lot of community spread, you hear that, and that means we really don't know there isn't any common factor in place that tells us. One of the first things that we learned, you all heard about, was travel. That's one of the things we identified really quickly, was people who were first infected here had traveled to one of the other spots. So hence the restrictions for people to go into quarantine if they had traveled to other parts of the country. So that's an example. If you look at the meat processing plants, if there's a worker there that's infected, chances are they have a family member or family members who are working in other areas. So we monitor what's happening, who their contacts were, where they're working, and then maybe have to start working with that other business where a family member's at if they become positive. So it's just looking at all of those issues. In Lincoln, part of our increased caseload, over 30% of the caseload is related to the meat processing plants. So that's really our main focus, is working on those meat processing plants now, and working with others that are contacts in the area. We're currently monitoring, just to give you an idea, 855 people in Lancaster County alone, and that's not dissimilar to other parts of the state, even though the numbers might be different. We have a system where people are checked in with every day to see if they have other symptoms, if they have any symptoms, if there are other needs that they have, so we can do some resources for them. For some of our families who have been adversely economically impacted, we've created care packages for them and help them get started, and then have them connected with another resource in the community to assist them if they're having needs for food or housing assistance, paying that. I'll just end with this one last thing. In our community, we have a large homeless population, and that's similar to a few other parts of the state. So we worked in Lincoln with our mission and created a quarantine unit. And actually, one of our senators became involved and helped us obtain some donations for how to set up the quarantine unit, which is a separate site from our shelter. We moved all the women, we moved the women and children, the family out of the shelter. One of our hotels is providing lodging for them, and we have some volunteers from churches providing some meals for them, and we have case managers working with them to get them into permanent housing. We also lowered the number of men in the shelter to decrease the opportunity for infection by renting another site in the community. So a lot of the work that we do is connected to our work with community members that are already here and involving every aspect, really, we have of city and county government to address the pandemic. One of the greatest contributions has been that our state legislature allocated funding that goes directly to local health departments. So to assist us, our local health departments were formed in our statewide system probably in about 2001, and really became more, were fully developed by 2002. So you have 18 local health departments, 19 with one county that hasn't joined in the greater system. But we've been chronically underfunded. So many of our health departments didn't have enough staff to go out and do the contact tracing or provide the epidemiological backup that we needed. So our state senators allocated funding that is actually for local public health directly and PPE. And by doing that, you all hear about FEMA and NEMA, but that's a process where you have to submit huge amounts of documentation, and it takes many months to receive any funding. Well, if your jurisdiction doesn't have a large amount of resource available to fund what needs to be done, that's a real barrier. So our senators were extremely receptive, and we've been able to submit our funding needs directly through a process at DHHS, and it goes to the governor's office for approval. And usually within a week, we receive that funding. So it's really, that has really enabled our local public health response to the pandemic. And this is a health response. This isn't a fire or a flood. So it's really, that's been critical to us going forward, and the state will document, all the documentation is submitted with those requests. So the state will try to recoup as much from federal agencies and the CARES Act so that it isn't always coming directly out of the state budget as much as possible. We're all very aware of that, but what that has done is enabled the local response. It's been critical, that funding, so I'll stop there.
That's great.
I'm sorry I've talked so long, but I'm trying to hit the high points for you.
Pat, can you, I'm just going to kick off with the first question. This is Renee. Can you share a little bit about what you think what these candidates need to be aware of in terms of when the legislature comes back in January, from a public health perspective? What do they need to be aware of? What will the legislature need to be talking about?
The legislature is still going to be talking about funding at the local level because we're still going to be addressing the pandemic. I don't see this being done and moved on like when we respond to a massive fire or flood. I think everyone knows that it's going to go on for some period of time. And right now we're trying to incrementally open things up more to help us at the same time have opportunities to learn how to respond to the virus and learn to live with it. So there's still going to be increasing need at the local level for ongoing public health funding to address the staffing that should be there. And as we grow more, we'll be able to respond in a different way by having those resources at the local level. And there's the funding perspective of that. But I also want to tell you, you know, I mentioned that we worked with one of our senators on the shelter. I know that our health departments across the state have really had to rely on their state senators and local officials to address needs in the community by just having that presence and availability to convene and meet with stakeholders, their constituents in the community, and share that has been really critical. Like, for example, in working with some of the meat processing plants, you can imagine there's a lot of issues related to that. And I know that some of our senators have been the ones that have stood beside the local health departments and helped them work with the owners and operators of those plants and trying to ensure that we do the right thing and protect both the community and the employees there. So those are a few examples of things. Some of the needs at the local level are much different, and we need to be able to bring those to our senators and help us advocate for what a community needs. So you'll find that all the health departments across the state really have a close relationship with their senators, even before this time, and that's been extremely beneficial. However, I think it's been a really clear, I think our senators have all gotten a much clearer picture of what it means to have local public health.
All right.
I have a
Helen?
question. Is it
Yeah.
okay?
Yeah, go ahead.
Is that okay? Actually, I have three. Thank you very, very much, Pat. That was extremely helpful. I actually have three quick questions. One is just clarifying the difference between the testing that's going on through Test Nebraska and any other testing that hospitals and so forth are doing. And if the mechanisms are actually the same, is it the same test everywhere that's being conducted, or is it something different? I think I would really like to know about your perception of gaps as we go forward. And I think it's great that current sitting state senators are being resourceful, but I think we're also in a position to help people get to resources. And so maybe you can point out some things where you think that could be helpful. And then the third has to do with telehealth. And if you're seeing some, you know, quote unquote, silver linings, I guess I'd say, you know, in using new techniques or advancing techniques such as telehealth that maybe were in more experimental forms prior, or something along those lines. So thank you.
Okay, as far as telehealth, I'll start there since that was your last. We at first had some bumps in the road on that in getting insurers to pay for it. But CMS, the Centers for Medicaid and Medicare, is paying for reimbursement, and then the insurance companies, the state and local medical associations took that on and worked through that. So telehealth has been widely available in areas where it hadn't been before. So that's been really, really critical to the help. Some of the gaps that we're going to see are kind of going back to what I was saying about we really need to have strong local public health systems. And I know I'm from local public health, but I can't emphasize enough how important it is to have those people in that front line that are actually doing the work. That's where, just as you know, in running, that it's really the local connections that make the difference, and it's the local community that understands the needs. We're still going to see needs as the recovery, as we move forward, for people related to perhaps childcare subsidies for food. We're looking at all those resources, as well as just the fact of being able to have access to testing when they need it. Testing and that follow-up. If we can't do the follow-up from the tests, it doesn't matter how much testing we do. So if you hear comments about, well, we need to get the test results back, well, if we don't get the test results back in a timely manner, I prefer 24 hours, same day would even be better, but they're working on that. That means as soon as we get those results, and all test results, positive and negative, come to the local health department. As soon as we get those results, we start trying to contact the individual and follow up, and that's how you control the spread of the disease. So that's going to be an ongoing need. As far as the testing, Test Nebraska is a whole separate test system, and that equipment and all that is done at the local at St. E's. Sorry, I keep getting. And so that's one test venue, just like with anything else. Then we have tests done at the Nebraska Public Health Lab. We have tests done at the Medical Center in Omaha. Nebraska Medicine has a lab that's separate from the state public health lab. Then one of our other big testing testers is LabCorp in Nebraska. So all of the technique for getting the test done, for obtaining what we call the specimen, the sample, is all the same. It's just where the lab is that does the testing, but all the testing sites have to be validated and show the sensitivity in that. So that's, even though there may be various different sites, all those lab results come back into a main site, run through the state and down to the local level. So that's going to be a big issue, an ongoing need.
We have time for another question if anyone has one. If no one has a question, I'm gonna, Pat, if you could just say, you sort of touched on, you alluded to policy gaps. I wonder if you could just say like what, 1 to 3 are the top policy gaps that you think have been brought to light because of this pandemic that the legislature should be talking about next session?
I think, and I hate to go back to this because it's always something you hear, but I think this ongoing issue with underfunding local public health and how we can work with that on that, both at the state and local level. I happen to be at a health department where we receive city and county funding in addition to this funding through the state. So just to give you a perspective, there's $5.2 million from what's called the Healthcare Cash Fund. That's the tobacco settlement dollars. And there's a funding formula of how that's distributed to the local health departments across the state. And the local health departments primarily are districts. There are several communities combined. You have to have at least a 30,000 population to receive any of this funding and to be recognized that way. Then there's an additional 1.8 million that we received with the H1N1. So that's $100,000 to the local health departments. And we are receiving, every local health department receives $11,000 in tobacco tax money. So you can see where the majority of the funding for most of the health departments is from that master settlement dollars. And there's a piece that's infrastructure, and then there's a piece that's population based, and I won't get into all that, but just to give you a perspective, that's about 5.2, 1.8, $7 million that's coming into local public health, if you look at it that way. And we just spent $27 million for 500,000 tests through Test Nebraska. So just to kind of give you a perspective, and looking at where we are. And there's national numbers to say what should be done by local public health. And our work isn't just doing pandemics. I mean, we're still working on active TB cases. We're still working on smoking related cessation, chronic disease. Now we'll be inspecting restaurants again. Part of our big work has been, even during the pandemic, is connecting with our restaurants and seeing how they're doing and reaching out to them and helping them with processes and other businesses. So a lot of our policy needs are related to that funding. I think there's some other areas we need to look at for policy allocations across the state, and determining directed health measures is another area that we need to look at. So I don't know if that answered what you were asking, Renee.
It does. Thank you, Pat. Well, we are at time, and we so appreciate, we know how busy you are, that you spent the time with us this morning, and hope you're doing well, and doing okay under the circumstances. I'm sure you're putting in long hours, and we greatly appreciate what you're doing for Lincoln, Lancaster County, and for the state. So thank you so much for your service, Pat, and for taking the time to be with us today.
Yeah, thank you for the invitation. And please, if you have other questions, Renee can let me know and I'll get back to you and try to be responsive quickly.
Thank you so much, Pat. Take care.
Take care. Be well.